folks, have access to basically computers in terms of their smartphones all the time. They're with them all the time. They're usually the first thing they check in the morning and the last thing they check at night. And it allows us to reach people in a more personal way.
That was Dr. Lisa Hightow-Weidman. She's an associate professor in the School of Medicine at the University of North Carolina at Chapel Hill. She's also the principal investigator of the Behavior and Technology Lab at Carolina and the UNC Emory Center for Innovative Technology. Welcome to Well Said. This is Carolina's official storytelling podcast. Saturday, December 1st is World AIDS Day. Every year since 1998, December 1st has been dedicated to raising awareness about the AIDS pandemic caused by the spread of HIV. On this week's episode, Lisa will share how she uses technology to provide HIV and AIDS interventions, such as a social networking app for newly diagnosed HIV-positive young men. Lisa says she first became interested in working with people who had HIV when she was in medical school.
And this was sort of an earlier time when we didn't have as great a treatments as we do now. And so folks actually didn't do as well. And they would often come into the hospital pretty sick, and some didn't make it. And I think for me, what I was really drawn to was that it was a population that was really impacted by the stigma of the disease and the stigma of having something that they maybe didn't tell their families about or their friends, and would come to the hospital alone. As I continued to train, that became something that was really important to me, both in working with patients and then as I developed a research career and thinking about how to address that stigma, to get more folks to know their status earlier, to get them into care, and to help them get the support they need to do well. So for me, I think my passion for HIV stemmed from kind of the medical side of things, but also the social side of things.
The stigma around HIV and AIDS seems to be the biggest hurdle.
Treating HIV is easy. It's one pill once a day. And the pills are tolerable. They don't make people sick. They're really easy. I mean, probably easier than diabetes, certainly easier than having to do insulin and monitor your blood glucose multiple times a day. However, folks have a hard time taking medicines every day because it's a reminder that they have HIV. And for some, that's still the stigma around sort of how they got HIV or why they were affected by HIV, and the judgment that they get from families and friends or people who they thought were friends, and society in general is still there. And I think that's, it's unfortunate. It stems from, homophobia, transphobia, racism, all of the things that we need to do better at. And I think if we did, we would continue to see improvements in getting folks in care and getting them, treated appropriately.
And Lisa tries to tackle that stigma, using mobile technology to reach people where they're more comfortable to share or respond to health information.
We've been doing technology-based interventions for many years. Our intervention started with really sort of just delivering them using a computer. So folks would log in at a location and kind of be provided with information. And then the world changed, and folks, have access to basically computers in terms of their smartphones all the time. They're with them all the time. They're usually the first thing they check in the morning and the last thing they check at night. It allows us to reach people in a more personal way. They, sort of have access to them, and it allows patients and participants to have access to information from us, again, at the convenience of their own convenience and their own time, and for how much time they want to invest. So it allows, I think, sort of a greater connection, actually, to healthcare and to health information. Particularly for youth, which is, a population I work with, or stigmatized or other marginalized populations that may not be comfortable accessing healthcare. The internet and sort of mHealth type interventions can provide information that they may not otherwise access.
By using mobile technology, healthcare workers are able to reach the people who need the information the most.
We know who continues to be most, infected and affected by the epidemic. It's sort of these vulnerable groups. We know that it's not simply just individual risk that puts them sort of at risk for HIV, and that there's other things that we need to address. So I think it's really sort of crucial that we just think about how to reach populations that aren't, sort of in the typical, catchment of prevention, that may not access prevention, that may not have access to healthcare, that have other more kind of pressing, competing priorities in their lives. And so how do we sort of make sort of what our priorities are for them important, and how do we incorporate it into their lives rather than sort of continuing to force people to incorporate into sort of the things that we think they should do. And I think that certainly with mHealth and sort of online interventions, the ability to empower patients and participants to sort of have control over their own sort of health and their sexual health is a really important thing. I think the key piece is that the way to really address it is to find everyone who's positive and get them tested and get them in care and get them undetectable. And if we could do that, it seems simple, but if we could, do that and then, get everyone who needs to be on PrEP and adherent to it, we could actually kind of reverse all of these things. I mean, I think, what we know is that there really is no digital divide when it comes to sort of access to smartphones. And this is, at least in the US. And so we have a means of providing information and providing access to skills and other ways to sort of engage folks in their health through something that is accessible to all. Even in sort of the global world, access to technology is continuing to increase. It's still not quite where we are here, but we're getting there. And so in some ways it sort of levels the playing field and gets sort of, the information and the access to those that may not have it otherwise.
And reaching these people is the first step in trying to get them to follow their treatment or prevention plans.
To get your message across, you have to engage people. Right. So, you can have all of the great interventions in the world, but if people don't come to them, if people don't listen, if people don't even sort of notice that they're for them, then they're not useful. And so I think mobile phones and smartphones and sort of mHealth in general, it allows us a platform to try and make our messaging and our interventions more engaging. If we can engage folks, then we can kind of have a chance at behavior change.
Lisa says the key to engagement is keeping them engaged.
So we know, most apps that are downloaded on any iPhone or Android device last, less than a day. So how do you design something that keeps youth, or other populations engaged long enough to get the benefits of what you're trying to deliver? And I think, for us, the next phase of this type of work is really trying to figure out how to do that in a world where you're competing against apps and video games and other technology advancements that are going to have much more money backing them, be much more exciting, much more fully developed and engaging. So how do we sort of set ourselves apart and at least create something that is usable and friendly and does show behavior change?
Lisa tries to answer that question as the principal investigator of Carolina's Behavior and Technology Lab.
It's really sort of me and some collaborators, Kate Messig, who's in the School of Public Health, and then a lot of project coordinators, and so it really Bat Lab is sort of the name that encompasses all of the research that we do. Our goal is really to address sexual health, whether it be HIV or STIs, for using technology. With a focus on those with, or vulnerable populations, whether it be related to sexual identity, gender identity, race, age.
She's also the principal investigator for the UNC Emory Center for Innovative Technology, or ITech. Lisa received a 5-year, $18 million grant from the National Institutes of Health to create the infrastructure of the center and initiate studies focused on youth at risk for HIV or already infected with HIV across the country.
Each of the studies has 2 principal investigators that are either here or at other sites around the country. We have 9 ITech sites around the country where we're doing the research. We have 3 cores. So we have a management core, which I lead here at UNC. We have an analytic core, which is run by folks at Emory and UNC. And then we have a technology core, which is also run here and at UNC that, again, facilitates kind of the development of the interventions and measurement of usage, and then some other novel technologies like home and home STI testing. So ITech is sort of our our beast. It's the largest, quote, project that Bat Lab runs because it's huge in terms of its reach and the number of, I think we have about 160 people that are in some way affiliated with ITech. We are just starting year 3. So it's a 5-year award. We're fingers crossed that it would be something that we could reapply for. It's taken us a few years to get things rolling. I mean, it's basically a network of studies that we're running that we started from scratch.
Some of these studies are independent. Some run in parallel to one another. And some actually compete against one another.
There's sort of 2 pilot studies, 2 apps. One's called Links and one is called My Choices. They're both apps that aim to increase HIV testing and PrEP uptake. We're doing some pilot work with them, and then if they're both found to be kind of feasible and acceptable, they'll be compared head to head in a kind of a trial called Compare that'll be kind of in starting later this year. I think the other piece, though, is that we do a lot of collaboration. So we have research network PI calls where we have monthly calls with the research PIs that are working on their projects and with the site PIs and with the cores, so we can learn from everything that's being done. We have a lot of centralized recruitment and retention procedures. So it's not sort of so independent that, we continue to make use of what we learn, in the network to improve the other studies.
And Carolina is the perfect place for Lisa to do this innovative work.
Well, I mean, I've been here since 2001 when I came to get my fellowship. And I mean, I certainly wouldn't be successful without having been here. The environment, the resources, the mentorship and leadership from my boss, from Mike Cohen and Joe Iran, and then, sort of the support of colleagues of, just sort of bouncing ideas off. I think it certainly facilitates, ability to do the work that we do. And then, we have a great ID clinic where I see patients, but we're also we've recruited many folks to engage with the interventions we've developed over time. So I can't really see myself anywhere else. I'm sure there are other places to do really good work, but there's never been a time where there's been sort of something I've needed that I haven't been able to kind of get, whether it's intellectual or infrastructural support.
If you have a story idea for Well Said, or would like to just let us know what you think of the show, please send us an email at wellsaid@unc.edu or tweet us at UNC. Thanks for listening to this episode of Well Said. See you next week.